Like, subscribe, and share. I don't know why this video keeps cutting off. I may just have to start it again. Okay. Well, it seems to be rolling now. Anyway, this is Tonya. Welcome back to Nurses Speak. I'm starting this video again for the third time as it keeps on cutting off my phone. So, this is the channel for Black nurses, nurses of color, and open to all nurses to speak, to share, to discuss anything, because no topic is off limits. Now, I just wanted to speak to my family for a few minutes today about two things. One, let's first address the need for some healthcare benefits, which hopefully at some point can be federally mandated for all frontline workers suffering from long COVID syndrome. We need something to address that. As you know, in the height of the pandemic, when nurses were considered heroes in this country, braving the threat of illness and death day after day, week after week, month after month, putting their lives on the line to take care of America's public, many of whom disregarded the protocols and the guidelines to reduce their chances of being infected, but went about their business anyway, unmasked, gathering in large crowded places, and of course increased the statistics of the number of people who became sick and also died, and in the process infected many others. But this video is not about them. This video is about encouraging you all out there who lobby and are politically active, either through your nurses association or with your local government, to lobby to your local politicians, Congress people, senators, to push for some state and federal health benefits for those frontline workers suffering with long COVID. And I mean a streamlined process where they don't have to go through any convoluted, complicated, and difficult process to get healthcare benefits to address their healthcare issues. And this goes beyond nursing. This is all frontline health workers, all essential workers who were out there, people working in utility companies, delivery services, police officers, fire officers, and it doesn't matter. It shouldn't be just those big cities. It should be every city and every small town in America who has frontline workers that were out there in the height of pandemic providing services to those that was necessary to keep communities afloat, to keep communities running, to make sure that people had services and health care, right? These are the people that were out there every day doing just their job and happened to have the unfortunate circumstance of coming down with COVID and then having lingering symptoms, many of which are debilitating, okay? We have people out there with heart conditions who were healthy, respiratory conditions, who were healthy people without comorbid conditions. People have debilitating vertigo, neurological symptoms, brain fog, things of that nature. Some may even be having neuromuscular conditions now, can't fully walk from their bed to the bathroom, right? We need to make sure these people are taken care of by this government, right? And as we know, the vaccine reduces the risk, but it's not 100%, and it's not long term. Did it help? Yes, it did. But let's face it, we need more in the line of services and healthcare benefits. That can't be overlooked. So if there's something you have an interest in engaging in with your local politicians, let that be on your agenda to bring to them. Okay? A streamlined process for accessing healthcare benefits for those frontline workers with long COVID. That's number one. The next topic I want to discuss with the family is, in the recent news, there's been a couple states that have enacted their legislation to allow our high and mighty, wonderful nurse practitioners to practice without physician supervision. Or I think it's termed a contractual relationship with a licensed physician. Now that's great. It's great in many ways because nurse practitioners can definitely be primary care providers in large urban areas, in remote rural areas, and anywhere where there is an increased need for accessible primary care. Because as you know, it's not just about having the benefits, it's about having the access. So thank you to all those nurse practitioners out there that are committed to primary care of the citizens within this country. I personally want to thank you for continuing to provide your service and elevating yourselves into that area of specialty. However, to whom much is given, much is required. And as you know, you get nothing for free in America. Everything comes with a price. So I would just want to share some friendly and sisterly recommendations to just make sure that when you're out there practicing, take no shortcuts. Continue to do all the prudent and diligent things you would be doing regardless of the position that you're holding, because you will be held to a higher standard. And particularly without that, I would say, support of the physicians, that contractual relationships, I wouldn't suggest you just eliminate that entirely, because you might want to also consider the fact that you may need to have some referral process in place where you could refer some of your difficult to manage cases to physicians that you're in partnership with to work with. Because let's face it, no matter how much an education a nurse practitioner has, they're still not doctors. Okay? And, you know, I've always felt, look, if you want to be a doctor, go to medical school. That's where physician training occurs. If you're a nurse practitioner, you're a nurse practitioner. You went to nursing school. And then you did a couple of more years to earn your practitioner's license. After being tested, of course. And so, work within your scope of practice. Because what we don't want to see is when CMS begins to look at things, as you know, they do a lot of studies and auditing and reviewing and investigating, is that now that we have much more nurse practitioners out there in force, not working with any physicians, we don't really want to see like a significant climb in patient referrals to emergency rooms, right? Because that kind of defeats the purpose. Because if you haven't noticed already, there's been a national agenda for a long time to decrease emergency room visits, or what they would term, quote unquote, I guess it's unnecessary hospitalizations. I mean, hospitals are sending people back home. They're not taking any more chances on, in most cases, admitting people who they pretty much have a good idea they're not going to get reimbursement for. But yeah, in terms of the referrals, I would hate to see a lot of NPs out there who not really fully, I wouldn't say competent, because you do have competence to a certain degree, but maybe the experience to confidently treat the public independently without having to make too many emergency room referrals. Now, of course, when it's necessary, it's necessary. But one thing I always like to say when it comes to practice or anything I'm doing professionally, stay in your lane. That's the best way to avoid an accident or any kind of collision. Stay in your lane. So if you know your lane is an NP, stay in the NP lane. Okay? Every state is going to be different. So the laws governing your practice are going to be different. Yes, there are some basic similarities, but there are differences as well. So it would behoove you to do your due diligence to make sure that you look carefully and understand fully the scope of practice in the state wherein you work. And if you're not even sure about that, work with your local malpractice coverage provider and make friends with a really good malpractice attorney if you can. Keep one on retainer that you can tap when you have questions about things. Because I'm telling you, prevention, as they say, an ounce of prevention is worth a pound of cure. So if you can prevent yourself from getting into any smelly, sticky situation, it would be in your best interest to do that. So know before you go, and when in doubt, check it out. All right? Because we live in a litigious society, and everybody's out there looking for their pound of flesh from somewhere. Don't let it be out of your pocketbook. Okay? So just keep it tight, keep it safe, stay in your lane, and CYA. And if you're a person who's accustomed to some shoddy, minimalistic documentation, you need to find a way to improve that and invest in a robust EMR that not only covers all the required assessment and treatment protocols, but also allows you the ability to modify the text and include narratives that are relevant to your patient care. This is vital, okay? And I'm not even charging for this information. This is free on YouTube. Many other people are talking about the same issues. And so, while I'm not a lawyer, I can't give you any legal advice. So there's my disclaimer. But you need to have a lawyer on tap that you can tap into when you have questions, because you don't want to be calling your state board asking these questions. Those are the last people you want to call with questions, because the way they see it, you call asking some basic questions, they'll be like, who is this person? Well, first you have to give all your identifying information anyway to make inquiries that are specific, and that just gives them an opportunity to follow up with you and target you. So have your policies and procedures in place. Hire you a decent QA person. So carefully screen and vet your office staff. Okay? And I'm going to repeat that again for those in the back. Carefully screen and vet your office staff. Because there are a lot of people out there taking up jobs in the healthcare sector. Not because they're such great paying places, or because they have a humanitarian concern to serve the public. They want access to personal information so they can steal it. They can make more money off of black market sales of PHI than what you paying them for a whole month. Let's face it. So make sure you have all your HR policies and procedures in place as well. And hold these people to the strictest, highest standards. This is no joke. This is no game. There's penalties for everything. And the last thing you want is to find yourself on CMS or the OIG, Department of Justice, CMS, excluded provider list. Because then you can't work with them. So you're basically going to be, not able to bill any Medicare or Medicaid for however long they say you are, or could be forever. It's up to them. They make the rules. So, yeah. So unless you're going to be strictly private pay, you need to have your ish together fully. All right? You might even want to hire a practice consultant just to make sure you cover everything A to Z. Okay? Don't leave any stone unturned. You can't be too cautious in this business. As I said before, it's highly litigious. So you want to make sure you're covered in all bases. All right? And if you don't feel confident enough taking on more than a certain amount of patients, stop taking more patients. Don't get greedy. Don't look at the dollars. Because it could be, you set yourself up to see 20 people a day. Hey, it could be that 21st person that could be a complete downfall if things don't go right. So if you know what you can handle, you set your limits based on what you can handle, right? Because don't complain now before you would complain, the doctor's dumping all the patients on you and you're expected to see all these patients, yada, 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 and you tired and you stressed and you burnt out, and then you go out there and practice for yourself and you practice in the same way, burning your own self out. At that point, you have no one to blame. So, just saying. Let's be smart. Let's take baby steps in this process. And don't take on more than you can handle. Don't contribute to your own burnout or your own exhaustion. Right? Do what you can. And if you're in it for the right reasons, everything will work out. And if it doesn't, you'll just move on to something else. The one constant thing in life is change. So, once you're always open and ready for change, life becomes easy. Or should I say, more palatable than if you're rigid and inflexible. So, I think that's all for today. It was so nice, again, checking in with you all. And again, like, subscribe, and share. This is your channel where no topic is off limits. Nurses Speak. And I'm out here walking and enjoying this fresh, cool breeze. Looking at the geese lined up around this lake I'm at here. And they're wonderful, beautiful creatures, just enjoying themselves, eating whatever little nuggets they're finding in the grass. But they're not bothering anyone, and nobody's bothering them. They staying in their lane in the grass, and I'm staying in my lane on the walking path. And everything's just moving along fine. So you enjoy the rest of your day. Tell yourself something good. Eat something good. Drink something good. And do something good. One for somebody else and one for yourself. Until next time, this is Tonya with Nurses Speak. Bye now.